All right, and we are live. So StreamYard is an incredible platform because we're able to see all of the comments and everything come through right in the StreamYard platform. So as people are coming in, we can get started. Okay,
awesome.
Yeah, I think we can wait about 1 minute just as people start trickling in. Let me just double check on LinkedIn right now. If you are tuning in live and you're able to, please put in the chat, your name. I guess I could see your name from LinkedIn, but your name, where you're tuning in from, and if you are a current MSL or you're interested in learning more about becoming one. All right. All right, I think we will just get started. So thank you so much for being with us today, Anita. We are so lucky to be with Anita today. For those of you who have watched our previous episodes, Anita is one of our alumni from the MSL Academy. So she went through the program, and she also, oh yay, we have some people coming in the chat. So she went through the program and now is a coach with the MSL Academy. So what we'll do today, it'll be an open, free-flowing conversation. So I'll ask Anita some questions, but if anyone who is attending live has any questions, this is your moment to ask. You can ask myself, you can ask Anita. We are happy to answer any questions you may have. All right, so let's just jump right in. Anita, do you mind introducing yourself and telling me and our guests a little bit about your educational background?
Yeah, of course. And I just wanted to also say hi to everybody and thank you to Swathi for setting up this session and for everything you're doing for aspiring and current MSLs that are eager to learn. I'm really excited to be here. So just a little bit of background about myself. My name is Anita Lee, and I have been an MSL for the past 4 years. I'm a clinical pharmacist by training. Just going back a little bit, I grew up with a dad who was constantly networking and creating relationships to grow his small business. And he had me join and speak at his networking group starting at the age of 10. So before you know it, I was developing communication skills, becoming sociable, and learning the importance of not only building relationships, but maintaining relationships as well. I carried that through my life and through pharmacy school. And so after pharmacy school, I did a PGY1 pharmacy residency and practiced as a clinical pharmacist for about 3 years. And that's where I really learned how to better understand the clinical care pathway and the patient journey. And then eventually I discovered the MSL role in the medical affairs space after meeting an MSL that was at my hospital, and then also diving a little deeper. And I was able to also dive deeper into finding ways to transition from a clinical pharmacist to the MSL space. And that's kind of where I met the people that are part of the MSL Academy. So I'm happy to be here and answer any questions.
Amazing, amazing. So that's one of the questions I was going to ask you is, how did you first hear about the MSL role? And what was it about the position that got you excited and that got you very interested to learn more and to dive in?
Yeah, I think my first interaction with an MSL was, at my hospital. It was someone who was really warm and friendly, but also very knowledgeable about the therapeutic area that she was there presenting on. And so I was intrigued and, started speaking with her after the presentation, and she gave me more information about the MSL role. Now, after that, I was able to find a few more people in my network already who had already transitioned to the MSL role. And so when we talk about networking, I think it really started there at the very beginning. And it's the reason why I actually looked into further becoming into an MSL, and then also was able to find out about having a coach that could help me transition into the career with a little more support. Coming from a clinical pharmacist background, I didn't quite have as much training or information about medical affairs. I didn't have, and I wanted to build a solid foundation. So that's a little bit about how I moved wanted to transition. But, I was looking for mentorship. I was looking for someone to provide me with some more guidance, and I was ready to hit the ground running. So I think when I, reflected on what I really wanted in my career, I realized that, this is exactly what I wanted. I was really motivated to go for it.
Amazing. And for people who are attending, they might have heard the acronym MSL. I know we're throwing it around quite a bit, but would you be open to just defining it for everyone? And, how, like, of course, people can Google what an MSL is, but what does an MSL mean to you? And how have you seen that play out?
Yeah, so an MSL is a medical science liaison, and I like to think about it as the bridge. So the bridge between the pharmaceutical company, but also the community, the providers in the community, in the therapeutic area, and on the ground that are actually seeing patients and practicing. And it's where I come in would be someone that could bridge any gaps between the two, and also bring in those insights from the people who are on the ground that are practicing, and bring them back to the company to see how, the goals can strategically align and how to improve that for eventually the end goal is for our patients.
Amazing. Yeah. Thank you for that. Because the last time we were chatting and I was on another, podcast, we were speaking about being an MSL, and I was like, wait, what about the people who might not know exactly what that is and really where the MSL sits within the entire schema of pharma. So yes, thank you for that. And so you were talking about, you were ready to hit the ground running once you found out about the MSL role. You were ready to do it. What led you to, learn about the MSL Academy, and what was it, that was the final, tick box where you were like, yes, I'm ready to say yes and to move forward?
So as I mentioned before, I had a friend who had gone through the program. So I think a lot of it is, networking and just, your relationships that you have, and maybe someone that has gone through the program and that saw success. So that is something that really helped push me into the MSL Academy, because it was someone that successfully landed, an MSL role, and it was somewhere where I could really see myself. So after a lot of reflection, and also a lot of just thinking, I really knew that this was something I wanted. It was a time commitment, and I was willing to do that. So I think it's really important to know that, like, jumping from a position that you're already in from the outside to the MSL world isn't necessarily like a stroll in the park. There's a lot of time that needs to be involved, and a lot of knowledge to be gained, because there is a little bit of different, lexicon that's involved, and different kind of mindset. So, you have to also put on your business hat, but also keep on your scientific hat. And so I like to think of it kind of as a social scientist is what I like to think about. But with all of that, I knew that I really wanted to do a coaching program, and I really knew I wanted some guidance on how to move forward and be successful to gain a position in the med affairs space.
Amazing. And so as you were going through the program, what were some of the key takeaways or some of the key things that you learned throughout the journey that you think really helped you stand apart to land your first role?
Yeah, I'm thinking back now, and I will say that one of the things that I really valued was the series, the webinar series, and the different modules that were created for the program. It gave me a solid foundation of kind of where, where medical affairs and like the positioning of the medical affairs department within a pharmaceutical company stands. And then also, I was able to kind of build my network. I was able to have small group sessions where we all shared our experiences and where we were in the process. And I think that really helped, because when you're going through something like this, when you're trying to jump from, your clinical role, or if you're a PhD and you're not really in the space, it feels kind of lonely, and it can feel a little, just lonely is, I guess, the best word to describe it. And to have someone to kind of talk to bounce ideas off of, to reflect with, I think is very helpful. I also did have some one-on-one sessions that really helped prepare me for interviews. And so I think along with all of that combined, it helped me gain confidence, and it helped me, I guess, build a solid foundation for me to transition over. And it took me, I think a common question I get is like, how long did it take you to transition from clinical pharmacist role to going into the MSL role? And I think it varies. It depends on how much time that individual wants to put into a program or put into the application process. But for me, it took about 7 months. It's something that I really dedicated a lot of time into and energy. And at times, I'm not going to lie, like I was very tired, and it's almost like a second job or a side hustle. So, you have to also, I think, also listen to your gut and also listen to your body. And so if you need to take a break, give yourself grace and to do that, but also be motivated enough to push yourself to continue to apply and interview, even though, it can be a tiring process.
Absolutely. I'm so happy that you brought that up, because I think that that's something that a lot of people go through, that roller coaster of a process where they get excited, they're in the program, they're applying, and then, they might not hear anything, or they might not hear anything positive for a few months. Then they take a break, they come back rejuvenated, excitement, reignited, and then they're ready to hit the ground running again, and go through that process. And so I do think it takes some of those waves, just because it is such a transition from being either a clinical pharmacist, another sort of healthcare professional, a clinical researcher. It really is quite a different role. But one of the things that I think is so important is to talk about some of the transferable skills that we can bring from these other roles. So, of course, you can't speak for, everyone, all the different practitioners out there and all the researchers, but I would love to hear from your background as a clinical pharmacist. What are some of the transferable skills that you found were like absolutely indispensable when starting and succeeding in your role now?
So absolutely, great point, Swathi. There are a few that come straight to my mind. And, as a clinical pharmacist, I was on rounds with physicians where we were collaborating in multidisciplinary teams and working together with the different healthcare team members, and not only the physicians, but also the nurses and nutrition and everyone else on that team. And so I think teamwork is definitely something that comes to mind, but also providing scientific expertise. So, whatever it is that you have a knowledge in, specialty in, for me, medications and safety, and also just keeping in mind anything for when medications were started, any monitoring that needed to be done. So bringing that to the forefront whenever I was in these team settings, having those good communication skills. So being purposeful with my communication, but also maybe a little persuasive, because there are a lot of ways that, you want to make use of your communication, right? Like you don't want to just communicate with no goal in sight. So being purposeful and persuasive are something that I think about whenever I'm thinking about my communication skills. And then also, I think time management is very important as well. That's a big one, because we are in a role where we're planning travel, planning meetings, planning our time. And although there is flexibility in the role, there's also a lot to do. And so if you're not spending your time appropriately, then, your to-do list can really start to pile up.
Yes, definitely. And I think that you hit on quite a few, different important skills that not only are transferable, but are also skills that make a successful MSL. So that leads me to my next question. What are the top 3 things you think, now that you've, transitioned into the role, you've been in the role for 4 years, what do you think are the top 3 things that makes someone successful at being an MSL?
Yeah, that is a great question. So my first one that comes to mind is being I think highly emotionally intelligent. I think emotional intelligence in this field is extremely valuable. Being able to read the room, be respectful of people's time, but also be able to, I guess, continue to establish that relationship, and in a way that you become credible and you build that trust over time. Relationships are not easy. It takes a lot of effort and a lot of time. So I think that having this high emotional intelligence is one way to really help you in your MSL role. Another thing is being flexible and having that ability to be comfortable with change. When we're thinking about the MSL role, we are receiving strategy from maybe the leadership team and maybe our directors. And so things can really change on an instant where, we were moving towards one goal or one strategy, and all of a sudden, because of some other circumstances, things have pivoted, and we need to also pivot with it, and we need to be comfortable with that and be willing to don't be resistant to it. I think another last one I think is, I'll go with like enthusiasm, because that, along with the enthusiasm you bring with like the science, the data, and also to the relationship is very important. Because what providers in the field, they don't always have a lot of time for, you don't want to waste their time, and they don't have a lot of time for you to, just sit around and not give them something that maybe that's valuable in terms of like data, or understanding their interests, or understanding, where, what kind of projects or committees or advisory boards, advisory boards that, that might align with them. So being able to have that foresight to see that.
Definitely, yes. And one of the things that you've brought up multiple times is, building relationships. Even like as a young child, you were already going to these networking events. I would love to hear some of the strategies that you've implemented in terms of like building those relationships with KOLs, and then not only building them, but then like fostering them and having them, even grow.
Yeah, and I think this topic came up on one of your last talks, just about consistency. And I think that is so important. So, having an introduction is great, but also being able to build upon an introduction and understanding, again, what the interests are of the person that you're interacting with. Is it going to be data? Is it going to be being part of, different projects or advisory boards, or maybe even posters? That's something that I think is very important when you're, trying to maintain these relationships. I think another thing is to pay attention to their movements as well. So are they going to be at a conference that's coming up? Are you going to show up for them? Because, it's okay for them to, it's good that, they can help you out, but what can you do for them as well? It's a two-way street. Relationships are a two-way street. So I think that's something to keep in mind when you're maintaining a relationship.
Definitely. And then as someone is going through, let's say they are a clinical pharmacist, they're a healthcare professional now, what are some of the ways that they can begin to work on some of these skills outside of, the conventional, like becoming an MSL? What can they do in between, or even like tomorrow, to start practicing some of these things?
I think what comes to mind is, leveraging your LinkedIn, social media. I think that's so important. Part of being an MSL is to start creating these relationships with people that you don't necessarily know. And that's what LinkedIn will help you do. So reaching out to those individuals and trying to open it up to see if they are open to having a quick conversation with you. But coming back and saying, what can I do for you? Like, if there's anything, let me know. So it's not just, a one-way street. I think they can look, people who are interested right now can look into conferences and networking at live conferences are great. Virtual ones, I think, aren't as valuable or useful when it's everyone is off their screen or on mute. I think the live conferences are really helpful. And Sidoni, I think, had mentioned some in the past too, but Medical Affairs Professional Society is one that we've talked about, Swathi. And then also they always have local events. So that's something you can look into to see if a local chapter is hosting a local event that you could go to.
Yeah, I would second both of those. I recently went to a conference, so the Healthcare Business Women's Association conference, and some of the best conversations I had were, at the tea station where I'm making my green tea and just speaking to the woman next to me. She, works at a big pharma company, and we're just having a great conversation about the recent session, but also then exchange cards, and you never know where that conversation can lead. So I agree, like going to those conferences, it's not even necessarily who's speaking on the panels or who's speaking on the stage. It's, who are you going to just run into at the tea station or run into in line for lunch and different things like that. So I feel like because of COVID and everything, I hadn't experienced so much of that until recently, until going to that conference again. And I was like, wow, this was such like a fulfilling experience for me as someone who loves to create relationships, loves to meet new people. I was like, wow, I definitely want to do more of this moving forward so that I can continue to engage and build these relationships and not just have it be limited to LinkedIn. And I don't want to say limited as a negative thing. I do think that so many of the relationships that I've made on LinkedIn are so meaningful. They've maybe started quote unquote virtually, but now I've met them in person and we've, become colleagues and friends and all of that. So it's I'm not trying to put LinkedIn potential relationships or, creating some sort of, inroads there as a negative thing or not as great as in person. But I do think there is just a different level of the number of people you can meet in such a short period of time at a conference.
I think LinkedIn is a great tool, and it's, again, it's a tool, but taking that beyond LinkedIn and being able to eventually, see someone in a face-to-face setting is going to, it's a different level of connection. And I think that's something that hopefully, since post-COVID, I know a lot of people have forgotten about it, and I did too, but once you start doing it again, you realize, how important it is and how much it ends up benefiting you. So
yeah, and I love that as a recommendation for someone that is thinking about transitioning into becoming an MSL. But in the meantime, how can they continue to build that network of people? Mm-hmm. Whether or not that network is pertinent to medical affairs or becoming an MSL, that's not the point. It's more of how can you stretch that muscle of, the outreach and the creating the relationship and continuing that relationship and stuff, I just think will serve you so well. And I would say it's something that you could even talk about on an interview.
Yeah, and I think there's other skills while you're in these social face-to-face settings, such as active listening or finding, similarities between you and this other person that you can actually start, enhancing and I guess strengthening, because I'm sure some of it's there, but when you're in a real life setting, it's definitely a little different. And active listening, that's a huge one that I actually forgot to mention earlier, but that's so important when you're building relationships and maintaining them, because it means that, you are actually not just, you're not just there with the person, but you're actually internalizing what they're saying, you're hearing them, and then you're actually providing something back that may be, helpful for them, or that you can actually be a resource to them for. So I think that's one I forgot, and that's a huge one that I always try to keep in the back of my mind. So I want to add that in there.
Yes, definitely. And then in terms of, as you made the transition to becoming an MSL, what were or maybe are some of the most challenging things that, come to, that are a part of the role? I would love to hear a little bit about some of the challenges in being an MSL, whether that's from, the the company perspective, whether that's from just the role itself and being, from a cross-functional perspective. Would love to hear your take on that.
One of the challenges that comes to mind that I think not only, I've run into, but maybe other MSLs, is that, access to providers or, those top tier opinion leaders, it can be difficult. And, even just starting those relationships. And so I think something that it's helped me is to get creative. It's helped me look for different ways to find these providers other than just to like email them a generic email or just one follow-up email. It's really looking for them and where they're attending at conferences, if they're at local conferences, being able to maybe stop by the office and see if that's a way to get in. I think just being creative, meeting them in the morning before they start their day for maybe a cup of coffee, or later in the evening outside of their just clinic schedule. I think those are really important things to think about, and just leveraging also your network and who so that you can maybe get an introduction. I think those are important too. There's a lot of ways to get creative on ways to access hard to reach opinion leaders. And I think it's, again, important to find out their interests and making sure that they align with your companies. And so that's something that I know that I had to learn, and I'm still learning on whenever I'm interacting with an external stakeholder.
Great. Yeah. And I know a little bit, we talked offline about this. I would love to ask you now is, before you mentioned that your previous role with being an MSL, you were focused on FDA approved products, but now you've kind of transitioned to more of a pipeline focused role. So I'd love if you could talk about kind of the similarities, the differences, and how an MSL plays a role in both of those contexts.
Yeah, and so I just transitioned over to what is a pipeline MSL role. As you mentioned, I am thoroughly enjoying this role, and it also has to do a little bit more with how I support clinical trials and research, since we don't have a FDA approved product that we're supporting right now. There's a lot of rules and regulations that are a little different than if I did have a product that I was currently supporting that's in the market. So the previous to that, I was supporting 2 different products. And so, learning how to work with my commercial colleagues was very important. Currently in my role, I don't quite have a commercial colleague, so that cross-functional collaboration is going to be expected later down the line than what it was for me previously. And then also, learning also more how to work with my marketing colleagues. That's a little different as well. Being less involved in more the clinical trials, but more so involved in maybe phase 4 post-marketing clinical trials. And currently I'm in a role where, it's all pipeline. So we're developing our phase 2, phase 3 programs. And so it's been a little shift, but I love kind of the more research heavy side, and using my skills to support my clinical studies unit there.
I'm so glad you're able to talk about that and share that with our audience, because that is something that I only recently heard about a few years ago, is having that differentiation of, you're an internal thought leader, helping the internal stakeholders more than the external stakeholders, right? And so that's it's a shift, but at the end of the day, it's still a lot of the same skill set. So yeah, I really appreciate you sharing and all of that. Is there anything else, speaking about those 2 different roles as you've transitioned between one and the other, that's important for people to know, especially if they're looking to apply for a role and they see, oh, it's called pipeline or it's called something. Are there any other sorts of MSL roles that people should know about, or any other key differentiating factors?
I think the beauty of also like the MSL space is that it's always evolving. And so that's kind of part of being in this world of constant change. And it's that companies are looking to see where the need is and maybe trying to evolve the position to be in a role where they can find that the MSL can provide value there. For example, a digital MSL position is something that I've recently started seeing, and something that is newer to the space, where they maybe are working more so on the digital opinion leaders. So those opinion leaders that are more active and vocal and have a presence online and on platforms like Twitter, or previously known as Twitter, now called X. But just an example of that. There's other roles I think that maybe I'm not as familiar with all of them. So that's also the other thing, is like I'm learning as well. But this pipeline role is something I think that is a little different than the traditional role, and it has evolved. So I'm happy to, go ahead.
Oh, no, I was going to say it's wonderful to see companies realize the importance of the MSL and not, just putting them in a bucket where they're only allowed to do XYZ things, but thinking about, okay, how can this skill set help other business units and help other functional areas?
Mm-hmm. Mm-hmm. I think the MSL role also, one of the biggest, I guess, qualities that a lot of MSLs have is that they're willing to look to see what job that needs to be done, and they're willing to kind of move towards that need and that ask, and how they can contribute to the team. There's so many things that we can do outside of just the key opinion leader aspect and just meeting with people one-on-one. There's so many different avenues and channels that we can provide value in.
Yes, absolutely. And speaking about, the role, people who are still learning about the role, it might be people in the audience right now. We defined what an MSL is. You've been giving us all of this great background on your role and other things that you've done in the space. What are some of the other misconceptions that you hear about the role, or maybe even when you started it, something you thought that would happen in the role that didn't, or the other way around?
I will say that a lot of the times, I think there is still confusion about the role, as you mentioned, and how that we are just another sales rep or a pharma representative. And that, I think I always like to break it down for the people that I'm talking to, and how the umbrella is like, the big pharmaceutical company or the pharmaceutical or the smaller one, but there's also always a commercial side and a medical side, and that there is kind of a firewall between, but the medical side deals more with, data dissemination and also insight gathering, and also the maybe like research. And I think that really does help. I always like to provide examples, but yeah, the misconception is that we are just kind of there on the sales side. And so I like to say that I'm actually just selling science, and you don't always have, there's no money, you don't have to buy it, but science is the currency. And as an MSL, that's kind of what we exchange.
Yes, I love that. I'm selling science. So someone has to trademark that somewhere. That's great.
Yeah, it's free, but you just have to talk to me.
Yes, absolutely. Yes. Yeah. And then, kind of talking a little bit about we've talked a little bit about your role now, how you made the transition, your involvement with the MSL Academy. Would love to hear, as you were going through the program and everything, and you were gearing up for your first interview, I would love to hear about some of the things that were really important to consider for that first interview. And, what do you think made the difference when you were, doing your interview before and after? Would love to hear a little bit about that.
Yeah, so I'm thinking back, and it's been a while, but my first interview, it was actually an opportunity that was I was able to interview with because of a person in the network, so within the academy. So again, a very important reason why I think your network and is so important. But I was able to talk to a hiring manager very early. The interview went well. I think a lot of the times as an MSL, they want you to know the science and they want you to be able to learn the science, but also, are you able to just navigate, like, how can you navigate a social situation, your personality? I think that's so, again, that emotional intelligent aspect is really important. And then I remember going into like more of those final interviews where stakes were a little higher. And, I had the nerves there. I think it's only natural to be nervous in an interview, especially if it's one of the first interviews in this new career choice or this new career transition. And I think it was definitely a learning experience. You make mistakes. I remember that I think there could have been more preparation that was done. There could have been more understanding that it can be a little bit of a conversation, and they're interested in seeing how you would present as an MSL in the field. So kind of connecting that presentation part, if that's the ask, to how you would do it as an MSL. I think after a few more interviews, so I will say I had like probably 3 or 4 before I was able to finally land my first role. I think that was very important because I was receiving rejections, and I was making it to, far, but I was receiving rejections. So it really made me sit back and reflect on what I was doing right, but also like what it is that needed to change and what I was doing wrong before, the next interview. So it was definitely just a learning process. I think it's like, natural to be nervous and to make mistakes, but the end goal is to learn from that mistake and bring, I guess, improve it for the next interview.
Yes, so many follow-up questions. So, I think that people are always wondering, when they see someone in the role that's where they want to be, they're wondering how many applications did this person send out? How many interviews did they do? Like, is there any way you could quantify some of that for the listeners?
I think, yeah. I mean, I could remember applying for probably when I first was trying to break into the role, over 50 positions. And so it was very tiring, to be honest. But I was also doing it in a way where I was tailoring each of my applications, or I guess my CVs, to the job description of each role that I was applying to. And it can be really tiring because it depended on each different TA. I think after some time, I did mention that I think it was very draining. And so I did need to take a break and come back after the holiday. I was more refreshed, kind of remotivated myself, but it's constantly something that I think it would really help if you had like a schedule of, hey, my goal by the end of this week is to send out 5 applications on Friday, and then continue to do that consistently, because after a while it is very tiring, and you deserve a break after that.
Yeah. And can you speak a little bit more about tailoring your application? Because I think that is something that is often overlooked. People are using, the same resume that, they use to get their clinical pharmacist position to, then apply to the MSL role. And then TA, also, if you could explain, therapeutic area, what that means, and how and why you would need to tailor your application specifically to one versus another.
So when you're looking at a job description, it can include a therapeutic area of interest that you're supporting. And I think from a hiring manager or a hiring perspective, you really want someone that has some sort of understanding of the space so that they don't have to start from square zero. And so I think understanding what therapeutic area that you're interested in is very important. So it doesn't have to just be 1 or 2. You can kind of take a step back and look at what kind of experience you've had. When I was a clinical pharmacist, I had experiences in the neuro ICU unit. I also had infectious disease experience, and taking some of those examples, like cases and examples from what I was doing when I was as a clinical pharmacist, and kind of creating a bank of maybe experience and cases that I could, bring up in those conversations, but also put onto my CV if it's necessary, to help make the connection that I do have some experiences with those type of providers and with that type of, I guess, condition or case. So I think that's one way that you can help tailor your CV. Another thing is, again, taking a more broad experience, like my participation in rounds, ICU rounds. That was something I translated into something that I could put on a resume where they can see that transferable skill of me working with physicians and being able to communicate and be persuasive and maybe be collaborative to end up helping patients, reach their end goal. So this is just like a small example of tailoring, but I think there are always ways to find examples online. I know that in the MSL Academy, this is something that we do to help the students that end up coming on board. And it's something that we know is very important to the application process.
Yes. And I think this topic is really important because, at the end of the day, a lot of people ask me, and this is something that's come up in multiple coaching calls within the MSL Academy with our current students is, for example, we have a pharmacist who is saying, I work in the ambulatory care setting, I see cardiology, I see endocrinology. How can I frame my experiences to help me land a role in any therapeutic area? And it's like, it's all about, how you're talking about your experiences, and you've had XYZ experience in cardiology, but maybe that patient also has some sort of endocrine disorder. Maybe they have diabetes. And so you're talking to a patient in a cardiology clinic or an ambulatory care setting, but they have more than one disease state. And so you're able to talk to that. Or maybe you work in a pharmacy setting and not an ambulatory setting. Maybe you work in a pharmacy. And so how many different drugs and how many different therapeutic areas are you evaluating every day? And are you speaking to the different patients coming in about these different drugs, right? And so there are so many different aspects of our roles currently where we're using and talking about all these different therapeutic areas, but we don't think about it because it's just such a part of our job. And so I think that is something too, talking again about transferable skills, that this also very much applies to therapeutic areas.
Yeah, great. And just to kind of expand on that a little bit, patients, like you mentioned, have a lot of comorbidities or concomitant conditions that they may have to have considered when you're going through their care. So these are things to kind of take notice and to maybe understand that, like, you have a lot more experience than you think outside of just maybe one therapeutic area. And you dig into your experiences even further than just your current role. Like, did you have any organizational experiences in the past? This is just one example, but when I was going through pharmacy school, I also was part of a dental mission trip where the pharmacists that attended this dental mission trip really helped with like the pain aspect of post-dental care, and then also evaluating them for physical examinations and education about HIV. And that was something that that I brought with me when I was applying for an infectious disease position. I think this is just a small example, but you just have to kind of dig deeper into seeing, your past roles, because sometimes you don't think about your previous experience as much as what you're doing now.
Yes, absolutely. And then, even building upon this, something that I hear all the time, so this speaks to our discussion on transferable skills, but something I hear all the time is that people just feel so unqualified to apply for an MSL role. And they're like, oh, I don't have the experience. It says in the job description, you're supposed to have, 1 to 3 years or 3 to 5 years experience. I know what I would say to that. And, I guess I'll just say it right now, because I was going to ask you first, but I guess I'll just say it because I can't contain myself. I would say, to me, a job description is there's suggestions, like everything where it says, oh, you need to have this, you need to have this. I just view them as suggestions. If I think that some of my skills can translate, as we were talking about before, if I think that I've had some experiences that perhaps are unconventional, but maybe they do speak to some of the expertise that they're looking for, I would say, why not apply? And then in addition to that application, of course, put in a little bit of effort with the networking. And as we were talking about with LinkedIn, sending a DM to like a direct message to someone at the company. Maybe it's someone in that department, or maybe it's someone in the HR department where it says HR, medical affairs, for example, and just sending them a message. They might not see the message, which is fine, but at least you feel like you've done your due diligence because you're putting yourself out there and saying, okay, I know I'd be a fit for this role, so I'm going to apply. And then I'm also going to make and be, as using your words, Anita, like to be the bridge, right? And see, is there some way that I can bridge, where I am now to, someone at the company to at least have some sort of mutual connection, and then, go from there, but kind of setting yourself up for success. And so that's my opinion. Would love to hear yours on, what if someone feels like they're unqualified or they don't fit those key, like requirements. I think that's oftentimes what they say is requirements for a role.
I love how you hit on, setting yourself up for success, Swathi, because I think that's so important. I do think, that in this world of where we just read job descriptions and we just look at a screen, we sometimes don't really, understand how this is just, a limitation of what they want. But once, you get in front of someone and once you are able to kind of tell your story, then that can be totally different. So I think there's a saying, it's like, you miss all shots you don't take. And I truly agree with that. I truly believe that. I think everyone has their different qualities, characteristics, and their different experiences. And the way that you kind of tell your story is so important. And so not only, I think that you brought up a good point, not only applying for the position online, but also doing the extra steps is so important. And this is just one example, but when I recently got my role from doing that exact thing, I applied, but I also tapped into my network, and I found out that someone who was an alumni at my my pharmacy school was actually working in that organization. And so reaching out to them as an extra measure to see if that is a way that I can at least get someone to, have a conversation with me to see if I'm a fit for them and they're a fit for me. So, and I think that applying and just letting it sit in the application universe is not necessarily the most effective use of your time, and it's not the best way to put yourself in the best position to get the role, because there's so many people that are applying online. And I think there are a lot of AI and different aspects of that process that might mistakenly weed you out, or might mistakenly leave you in the platform or whatever it is. And so taking the extra steps is so important. So that effort with networking, I totally agree with you on.
Amazing. So if anyone has any questions, I know we've been babbling for the past, 50 minutes. So we'd love to open it up to any questions that anyone has. Please do not hesitate to put them in the LinkedIn chat here, and we can take a look at them. In the meantime, I have other questions as well. If people don't come forward with any questions, but as you're looking to the future, how would you say, even actually, like, let's go back a little bit, but even, from the last 4 years of being in the role and then looking to the future, what would you say has been, like something that's evolved in the MSL role and something that you continue to see as something that will change?
I think the easy answer is AI, because that is something that is kind of top of mind for everyone in the pharmaceutical space, and how to leverage that AI in a way that is both respectful to, the patients that we're serving, but also, time-saving measures on our side. So I think that's one thing. I know that, there's a lot being developed in the AI space and in terms of the resources and what they can be used for. So understanding and not being afraid of it. So if you're someone that's interested in going into the MSL position, trying to be knowledgeable and participate in those webinars, or like learn or read more about how important AI can be in this field, and not trying to shy away from it, because it's coming and it's going to come regardless of if we want it or not. So leaning in and start being comfortable with it, even if you're not. That's one thing. I think just like the different positions within the medical affairs space, like there's always an evolution, and we already talked about that before, but I'm not really sure I can't even predict all the different avenues that, the MSL position can be kind of utilized in. And so maybe just kind of being ready for what's to come there, and being able to adapt your resume and your experience to something that maybe is coming up in the future.
Yes. All right. So we have a question in the chat. How important is clinical experience for the MSL role? This person is asking as a PhD who has done clinical research and preclinical research in disease areas. Thank you.
Thank you for your question, Aminal. So I can take this one first,
Sure.
as I think it is very important to have at least a baseline understanding of that process of how the steps of clinical research and preclinical research is a little less prominent in, I think, the MSL role, but more so in like research and development. It's good to have that understanding, but I think as MSLs, we're kind of dealing more with like the later steps and the humans that eventually will be receiving the molecule or the medications that go to market. So I think it is important, but leveraging more of the clinical research experience. And I'll if I missed anything, Swathi, I'll pass it over to you.
Yeah, I was going to say that your experience with clinical research and preclinical research will be helpful. I'll echo the same sentiment that clinical research will be more important. But that being said, at the end of the day, it's all about how you can communicate this information. And as Anita said, to be the bridge, to be that communicator. Sidoni calls it to be the connector. How can we, as MSLs, be the person to help disseminate this information, and how can we disseminate it in an objective way? And so that is, I would argue, just as important as clinical experience. I think clinical experience gives you a lens where you can say, okay, like I've seen patients with XYZ condition, and I think that's helpful. However, I think that when it comes to the role and being successful in the role, it's more about, okay, someone who has clinical experience and a researcher, both of those entities or both of those people are going to know how to, read primary literature, academic paper. They're going to know how to break down the, important details of it. But what really sets those people apart in an MSL is someone who's able to then convey the key important information from it to someone who is, a KOL or an opinion leader in the space. So I guess we're both speaking a lot, but I would say in short, I think it is important, but what's more important is how you can communicate that information more than the clinical experience itself. I think clinical experience helps, but if you look at the proportion of people who are PharmDs, PhDs, MDs, it's pretty split down the middle. And so I don't think anyone is going to get preferential treatment based on having a PhD or a PharmD or an MD. I think it's more of how they come off and how their interview process goes and how they're able to articulate certain complicated concepts.
I'll add one more quick comment too, is that on the teams that I've worked on so far, they are just so diverse in backgrounds, and that's something I think the leadership and the companies look for. They don't want everyone to be just a PharmD or everyone to be a PhD or everyone to be an NP, right? They want a diversity of backgrounds because we all bring a different perspective. So, you know, my previous teams, I had NPs, PhDs, PharmDs. Now I have PAs on my team. Even like if they don't come from a clinical background, like clinical experience background, I think that clinical research background is so helpful too. And it's the way that you can communicate that data, but also ask the question after of what else do we need? What's missing that the community or our providers are looking for? So I think a diversity of backgrounds is definitely something that companies are open to.
Yes, well said. All right, so we have another question coming in the chat. So as I have gone on MSL interviews and met with hiring managers, after I found out that I did not get the role, I asked for feedback from hiring managers. A common thing that was told to me was that they moved on with people that had more pharma or TA or therapeutic area experience. Is there any way for me to combat this on future interviews?
Swathi, do you want to take this one first, or?
You can go first. Go ahead.
Okay.
Mm-hmm.
So just thinking back, I know that, you know, hiring managers can be really, like their time can be limited because they are going through so many interviews. And I think that is not something that, you know, you can control. I think a good way to, you know, address this barrier that you may have is using those transferable skills and translating them in your interviews. So being able to communicate kind of the reason why you think you will have this experience, this pharma and therapeutic area experience because you do X, Y, and Z already. And that's a good way, I think, for them to understand, like, okay, once, you know, they get the position, they don't need as much hand holding, and they'll be very, they'll be able to kind of, again, hit the ground running. I think that's so important because time is always limited. I think when you're trying to fill a position and you're trying to also, you have all these goals and strategies that you need to implement. So it's a lot for, I think, hiring managers to sit there and explain exactly what it is that are, you know, provide feedback. But to move forward and for you, I think it's very important to be able to translate those transferable skills, to be able to communicate that.
Yeah, I would echo the same thing. And so it's not just about, okay, you haven't had an experience in pharma yet. And it's not just about, oh, okay, you haven't, you know, had, you know, a bunch of experience, let's say in dermatology before, and that's the therapeutic area that you're applying to. But how can you demonstrate through, you know, partially transferable skills, but also, you know, other experiences that you've had that show that, let's say, like, you know, so far, you know, you work in a clinic setting and you work in cardiology. I don't know why I keep picking cardiology, but that you work in the cardiology setting. So again, like, who are you seeing within the cardiology context? Are you having any conversations pertaining to dermatology? Or, so that's one of the routes. The other route is that maybe you're not having conversations about dermatology, but you can take some of the ways that you stay up to date on clinical research or the, you know, the new guidelines and things like that in cardiology, or show that you are such an expert in cardiology that it is going to be a piece of cake for you to take on any other therapeutic area because you've built such a great foundation in this other therapeutic area that you could easily translate it to another. And it's actually, like, it's something that I'm always fascinated with because I see MSLs, for example, that start off, you know, in HIV, and then all of a sudden their next role is in dermatology. And I'm like, that is amazing. But to me, that means that they've demonstrated in their interview process that, you know, yes, I'm an expert in this, but just because I'm an expert in this, that actually means that I can become an expert in any therapeutic area because, you know, I'm willing to know where to look, where the resources are, and I'm willing to do the work to figure it out. So I think that's also a key part too, is you don't necessarily need to have that therapeutic area expertise. Of course it helps. But if you don't, then how can you demonstrate that what you've done in the past can then set you up to be very successful in learning it. Then the other thing to say is like, if you don't have other pharma experience, one of the things to consider is that, maybe you don't initially go into becoming an MSL, but maybe you consider other medical affairs positions. Like there's medical information specialists, there's medical information managers, there's medical communications, all sorts of levels within medical communications. And those are, again, how can you convey this information, but from a more internal standpoint. So you're not, a field-based position. You're not going out and speaking to different, key opinion leaders or external stakeholders. Instead, you are the information expert or the medical expert on that team as it pertains to information flow or as it pertains to, different bits of content that are going out, from labeling all the way to, blog content for that matter. So I think that could be a great way. And I think a lot of people that are interested in the MSL role, like it doesn't have to be I'm doing this now and I immediately want to transition into the MSL role. You could take on another role along the way. I also know people who have decided to go into clinical operations, or they've decided to go and become like a clinical scientist or something on the R&D or clinical science side. And then due to what they understand now about clinical research from, being on those teams, they're like, now I'm ready to convey this information to external stakeholders. And so now they want to become MSLs. So that would be another thing to consider. I do think that those roles are just a smidge easier to break into. And so that would be something to consider. And if you want to ask more questions or continue the conversation about that, we're happy to do that. Also, I didn't realize it's already 9 o'clock Eastern. So that just flew by. What a great conversation. Does anyone have any last minute question that they want to put in the chat? Because we're happy to answer it. We'll answer one more if it comes through in the next minute or so. But otherwise, thank you so much to everyone who came live and who, was participating and everything. Amazing. Oh, we do have one more question. Okay. Minal said, are there companies that are more open to hiring MSLs with no prior experience? Ooh, I'll let you take that, Anita. I have some thoughts, but I'll take it after you.
That was me 4 years ago. So I would say yes. Not all companies necessarily will do that, but I don't think that it's not out of the question. It's, again, the way that you can connect with the hiring managers, the team, and show your value and what you can bring to the table. So I would say the easy answer is yes, there are companies that are open to hiring MSLs with no prior experience.
Definitely. I would say if we are comparing and contrasting, companies that might be more interested, I would say that there isn't really a particular type of company that would be more or less interested, because, I see, some smaller companies that are like, you know what, like we want someone who knows it because we don't have anyone to help train them. So we want someone with previous MSL experience who's just going to come in and do the thing, so that there is that side. But then there also are other smaller companies who are like, you know what, we understand we don't have the name recognition, so maybe we'll take on someone who has less experience and then they can grow with us. So it's just like the perspective that the company has, because some companies are more like the first example and the other ones are more like the last example. So it's not really like, it doesn't really come down to size or anything. It's more of who is the hiring manager and are they willing to take a chance on you? And I think that those hiring managers can be found in any company.
Along with that, I would say, timing as well, again, with the company, where they're at in their timeline with the product that they have, if they are at market, if they aren't. So again, I echo everything that Swathi said, but I think it really depends on the strategy of that company and the team that they're hiring.
Amazing. Well, thank you so much for everyone's engagement and for everyone coming this evening. I know it's late, but great conversation. Anita, thank you again for your time and for sharing your expertise. And we will be back next month to have another great conversation.
Thank you, everyone.
Thank you.
So engaging. Bye.